So we're going to look at the anatomy of the chest. Okay, that is the bony structures first, and then we look at the soft tissues. That is the heart in relation to other organs. That is the lungs and the blood vessels. We're going to look at the heart in some details because you're going to be taking pictures of the heart, so you need to know the anatomy of the heart. And not only the anatomy, but when we do physiology, you have to know how the heart works. Okay, also going to look at the aorta because the aorta is one of the largest blood vessel in the body, or the largest blood vessel in the body that arises from the heart. So you have to know about that as well. All right, so let's look at the bony structure of the heart. I mean, the bony structure of the chest. Um, and when we talk about positioning the transducer or the probe, it is in relation to the bony structures. So you have to know the bony structures fairly well. Of course, we're going to look at the manubrium. You know, that's the top of the breastbone. The breastbone, we call the breastbone the sternum. The top of the breastbone, or the top of the sternum, we call the manubrium, and then the lowermost portion we call the xiphoid process. The clavicles are on the uppermost uh, surface of the chest, and it comes in to meet the manubrium. That is the top of the sternum. And of course, you know the ribs, which comes out from the sternum and they go posterior. We're going to talk about the supraclavicular fossa. And the reason why we're going to talk about the supraclavicular fossa is because we do a lot of scanning there. We take a lot of pictures from the supraclavicular fossa and then also the suprasternal notch. So you have to know those two landmarks. All right. So of course, the bony chest looks something like this, and then that's the clavicle. Okay, so on the uppermost portion of the bony chest, you have the clavicle, which moves from the shoulder. You can see it move from the shoulder and comes in to the manubrium. That's the top portion of the sternum. Then you have the manubrium, which is the top uppermost portion of the sternum. Then you have the body of the sternum and the xiphoid process right down there. Again, these bony landmarks are very important because when we tell you to position the probe, uh, in the subxiphoid area, you have to know where that is. Okay, all right. So the ribs, of course, they articulate with when we say articulate, they come in contact or they join the the body of the sternum or the manubrium in front, and then the vertebrae at the back. Okay, so that's the ribs, and of course, they protect the soft tissues in the chest, the heart and the lungs and the blood vessels. Okay, we gonna mention or we're gonna talk about intercostal space a lot because the intercostal space, that's where you're going to that's where you're going to place your transducer or probe. So when we talk about the first intercostal space, it is the space between the first and the second rib. When we talk about the second intercostal space, it's the space between the second and the third rib, and the third intercostal space is the space between the third and the fourth rib, and so forth, so on. So, of course, this is your bony chest, and that's your first rib. Okay, the first rib is the uppermost rib. Of course, we said that it articulates in front with the manubrium right here, and then it goes to the vertebrae at the back. Okay, so the space between the first and the second rib is what we call the first intercostal space. Intercostal because the ribs are what we call costal. So the first intercostal space is the space between the first and the second rib. Then the second intercostal space is between the second and the third rib. And the third intercostal space is between the third and the fourth rib, and so forth, so on. We usually position our probe or transducer in the intercostal spaces. So you have to count the spaces, and you're gonna put put your transducer there. Okay, so you have to know how to count the intercostal space. Okay, so when we talk about intercostal space, you have to know what we're talking about. Now, of course, we mentioned supraclavicular fossa and suprasternal notch. The other name for that is jugular notch. We commonly put our transducer in those positions. So again, this is your clavicle, which comes from the shoulder and articulates to the uppermost portion of the sternum, the manubrium. Okay, this is your clavicle. So above the clavicle is what we call the supraclavicular fossa. Supra means above. So the supraclavicular fossa is right in this area above the clavicle. We commonly put our transducer there to get image. This is your jugular notch or suprasternal notch. Suprasternal because it's at the uppermost portion of the sternum, and notch because it's a little indentation right there. A common position for us to put our place our transducer. Okay, the other name for it is jugular notch. So, or supraclavicular fossa and suprasternal notch. So you have to be familiar with these landmarks because you're going to position your transducer probe to get image. All right, so we look at the bony chest, and that's all you need to know about the bony chest to do echoes. Now we're looking at the soft tissue. Okay, so slightly towards the left side of the chest, you can see the heart. The heart is right there. Okay, and the heart is flanked by the left lung on the left side and the right lung on the right side. You can see that the left lung has two lobes. It has a upper and a lower lobe, whereas the right lung has three lobes. It has a upper, a middle, and a lower lobe. Okay, and then you have a bunch of blood vessels which enters or leaves the heart. The inferior vena cava comes from below and enters the right atrium. Superior vena cava comes from above, also enters the right atrium. The aorta, big aorta, leaves out of the left ventricle and comes up. Okay, so this is the aorta and its branches. Okay, the diaphragm, this is the diaphragm. It separates the chest cavity from the abdominal cavity. Okay, so these are essentially the soft tissues in the chest. Now, you need to know a little bit more about the heart because you're going to take pictures of the heart. So you have to know something about the heart. The heart is essentially a muscular pump. The heart is made up mainly of muscles. Okay? So the heart is a muscular pump that pumps blood throughout the body. It is located more in the left chest, so it's slightly towards the left side. Okay? The normal weight of the heart is about 250 to 350 grams. Okay, that's the weight of the heart. Slightly less in females and a little bit more in males. Okay, so if you were to look at the heart, okay, the heart, if you took the heart out of the chest, the heart would look something like this. It's a crowded slide, but it's showing you the blood vessels on the surface of the heart. You can see on the left side, okay, this is the left anterior descending coronary artery, and this is the circumflex, left circumflex coronary artery. and this would be your right coronary artery. So these are blood vessels that are located on the surface of the heart. When these blood vessels are blocked, you either get an angina, what we call angina pectoris, that is chest pain, or if it's a sudden blockage or occlusion, you get a heart attack. So these are the blood vessels on the surface of the heart that is very important because they actually penetrates the heart muscle and give the heart muscle nourishment. Okay, so these are what we call coronary arteries. Just behind this this left atrium, you have what we call the left main. It's a left main blood vessel. It's a blood vessel which splits to give the left anterior descending coronary artery. The other name for this is LAD, left anterior descending coronary artery, and it also, when it splits, it gives off the left circumflex, which loops around the back of the heart. And then this is your right coronary artery with its branches. So those are the blood vessels on the surface of the heart. These blood vessels that runs on the surface of the heart, they comes from the aorta. Okay, so these blood vessels comes from the aorta, and and when we do a little bit more anatomy, you will have a better sense as to where in the aorta it comes from. Okay, so this is what the heart looks like. Okay, you can see that this is your inferior vena cava, and what we do, veins, we depict veins as blue and arteries as red, because veins gonna take deoxygenated blood from tissues and organs. That's deoxygenated, that is blood that is somewhat devoid of oxygen. So we depict it as blue. So the inferior vena cava uh, comes and it empties into the right atrium. Your superior vena cava, which comes from above, also enters the right atrium, drains in the right atrium. Okay, and as mentioned before, your aorta is going to take blood from the left ventricle. This is the aorta, and you can see the portion of the aorta that goes up, we call this the ascending aorta. This is the aortic arch because it arches over, and then these are some branches that comes off the aorta. This is the descending aorta because it descends. Okay, so again, the surface of the heart. Okay, the right ventricle is usually over this side, the left ventricle is over this side, and these are blood vessels on the surface of the heart. Very important, because when those blood vessels occlude or block, you either get an angina pectoris or you can get a heart attack. Okay, so the surface of the heart, um, there's the pericardium covers the heart. So the heart has a covering. We call that the pericardium. Okay, it covers the heart. The pericardium is made up of two layers. You have an outer fibrous layer and an inner serous layer. The inner serous layer is comprised of two layers as well. An outermost, what we call parietal, and an innermost visceral. So the heart is covered by the pericardium and it protects the heart. The pericardium protects the heart. Okay? There again is an outer fibrous layer we call the outer fibrous pericardium, an inner serous layer, inner serous pericardium, which is made up of an outer parietal and an inner visceral. So let's look at it and see, because vision, when you can see something, you can commit it to memory more. So again, there's an outer fibrous pericardium. We strip that away, so you're not going to see that. So the heart is right inside here, and we sort of highlight the pericardium, which covers the surface of the heart. Okay, we remove the fibrous pericardium, so all we have now is our serous pericardium, and the serous pericardium is made up of an outer parietal layer and an inner visceral layer. Okay, and then this is the pericardial sac right here with pericardial fluid. This is all exaggerated for you to appreciate it. This pericardial sac or pericardial fluid is something you can't see unless there's pathology. Unless there's a disease situation, you can't see it. Okay, but it was exaggerated here for you to have for you to get an idea what we're talking about. Okay, so again, the pericardium covers the heart. We remove the fibrous pericardium, so all we have now is what we call the serous pericardium. And the serous pericardium is made of an outer parietal layer and an inner visceral layer. This is really a potential space. And so the pericardial fluid is not a lot, okay? It's very minimal. If you were to cut the heart, if you were to cut the heart in two, okay, you'll have the left ventricle over this side and the right ventricle is right there. And what separates them is what we call the ventricular septum. So this thick muscle, again, remember the heart is mainly muscle. The heart is a muscular organ that pumps blood. Okay, so this thick septum, ventricular septum, separates the heart into a left ventricle and a right ventricle. Okay, all right. So again, as we said that the pericardium, the outermost portion of the pericardium is what we call the fibrous pericardium. Is thick. Okay, and then the innermost portion is the serous, and the serous is divided into your your visceral and your visceral and your parietal. Okay, all right. So the serous pericardium divides into an outer parietal that is fused with the fibrous pericardium and an inner visceral pericardium, which is part of the epicardium. So the pericardium is, remember now, the pericardium is separate from the heart. It's a covering. It's a covering for the heart. Okay, it's the outermost cover of the heart. If you remove the pericardium, then you get to the heart itself, and the outer layer of the heart is what we call the epicardium. So the outermost layer of the heart wall is what we call the epicardium. The middle layer of the heart is the myocardium. Myo means muscles. Okay? So the middle layer of the heart wall, we call that the myocardium, which is composed of cardiac muscle, just muscle. And then the innermost portion of the heart wall, the innermost portion that is in contact with blood, we call that the endocardium. So these are names that you need to remember. And the thing about it, once you go over it over and over and over, then it sticks. Okay? Epi means outer, myo is the muscle layer, endo means inner. So, it sort of makes sense. The middle layer is the myocardium, okay, composed of muscles. And then the innermost layer of the heart wall, which is in contact with blood, we call that the endocardium. Endocardium. So if we were to cut the heart, okay, it's best to cut, if you can cut the heart, you can see the structures. So again, we'll remove the pericardium now. So the outermost layer of the heart wall is what we call the epicardium. Epicardium, it will be right here. And then the middle layer, which is right, here's the muscle, that's the myocardium. And then the innermost portion, which is in contact with blood, that's the endocardium. If you look closely, you see these little humps. This is what we call papillary muscles. These little humps right there. So this is the left ventricle. This is your ventricular septum. This is your right ventricle. You can see this little hump right here. This is papillary muscle. And then attached to these little humps, you have these little cord-like structures. This is what we call the chordinae tendineae. Okay? Cord-like structures that attach to the papillary muscles, we call them chordinae tendineae. And they attach to the on the surface of the heart valve. This is your mitral valve right here. Mitral valve separates the left ventricle from the left atrium on top. Okay, so this is the left side. This is your left ventricle down here. This is the papillary muscles, chordinae tendineae, which attach to the on the surface of the heart valve. This is the mitral valve right here. The mitral valve separates the left ventricle from the left atrium. Okay, this is your right ventricle. Right away, you can see that the right ventricle is more trabeculated than the left ventricle. Okay, there's more going on inside here, and you can see that you have three papillary muscles. On the left side, you have only two papillary muscles there. On the right side, in the right ventricle, you have three papillary muscles. One, two, three. Attached to these papillary muscles, you have the cord-like structures, chordinae tendineae, and they attach to the on the surface of the tricuspid valve. The tricuspid valve is on the right side, and it separates the right ventricle from the right atrium. Okay, the right atrium is on top, right ventricle is below. These are your papillary muscles. Your tricuspid valve. Tricuspid because it has three leaflets. Again, your inferior vena cava, which carries deoxygenated blood, and your superior vena cava, which carries also deoxygenated blood, empties into the right atrium. So they're going to dump deoxygenated blood into the right atrium. Then the blood is going to travel across the tricuspid valve into the right ventricle. It's going to leave from the right ventricle across the pulmonary valve into the pulmonary trunk. So this is what we call the pulmonary trunk. Deoxygenated blood in the right ventricle is going to leave the right ventricle through the pulmonary trunk, and then it's going to travel to the pulmonary artery. There are two pulmonary arteries, one on the right and one on the left. Okay? It's because it's going to go to the lungs. You have a lungs on the left and a lungs on the right. So you need these pulmonary arteries to take the deoxygenated blood to the lungs, and the pulmonary artery is going to enter the lungs. Okay, it's going to divide up into capillaries and enter the lungs. When you breathe in and out, you breathe in oxygen. So now this deoxygenated blood, which is blue for depiction, when you breathe in and out, you breathe in oxygen, and the oxygen enters the blood, which is leaving from the lungs. Okay, so now the blood that is leaving from the lungs is going to be richly oxygenated. And that oxygenated blood leaving the lungs is going to travel via pulmonary veins, okay, to the left atrium. There are four pulmonary veins, two on the left side of the left atrium and two on the right side. Okay, you have an upper and a lower. So there are four pulmonary veins which enter the left atrium. The pulmonary veins takes oxygenated blood from the lungs, and it's going to dump that oxygenated blood into the left atrium. Then that oxygenated blood is going to traverse or going to pass through the mitral valve into the left ventricle. Okay, so that's a quick overview of the structures and function of the heart. Again, tissues and organs needs oxygenated blood to make energy. Okay? All tissues and organs need energy to work. They are working. They need oxygenated blood to work. That oxygenated blood comes from the fact that you're breathing. When you breathe in and out, you breathe in oxygen, goes into the lungs, and the blood that's passing through the lungs now becomes oxygenated, rich with oxygen. That oxygenated blood is going to leave the lungs and travel to the left atrium via pulmonary veins. Then this rich oxygenated blood going to move from the left atrium across the mitral valve into the left ventricle. It's going to leave from the left ventricle through the aorta, rich oxygenated blood. That's why it's depicted as bright red. And then it's going to travel to all over the body. These are blood vessels that comes off the heart of the aorta, going to the head and neck, and then the aorta descends, and you have blood, rich oxygenated blood going to the limbs, the trunks, and the lower extremities. Okay? When the organs and tissue remove all of that oxygen, well, not all the oxygen, it removes a significant amount of oxygen, then the blood is said, we refer to the blood as deoxygenated. So the veins, which takes blood away from organs, is usually deoxygenated blood, and we depict it as sort of blue. The blood that's going to the organs and tissues is usually bright red because it contains a lot of oxygen. But the blood that is now taking blood, sorry, the blood vessel that takes blood away from the organs and tissues, we call them veins, and they're depicted as sort of bluish because they contain deoxygenated blood, blood that is devoid of oxygen somewhat. And then that deoxygenated blood, they all coalesce and either drains into the inferior vena cava from below or the superior vena cava from above, and then dumps the deoxygenated blood into the right atrium. Then the blood is going to travel across the tricuspid valve, which is right here, into the right ventricle. It's going to go through the pulmonary valve into the pulmonary trunk. This is pulmonary trunk. Then to the right or the left pulmonary artery to the respective lungs to get oxygen. Okay, so the process is repeat itself. So again, the right atrium, what I've been saying all along is that the right atrium receives blood from the inferior vena cava and superior vena cava. Okay, so that's what I've been saying. So the right atrium receives blood from the inferior vena cava and the superior vena cava. The tricuspid valve, which is located between the right atrium and the right ventricle, tricuspid valve has three leaflets. There is a septal, there is an anterior and a posterior leaflet. We'll go over this multiple times so you will remember the names. So tricuspid, tri means three. Okay, so there are three leaflets in the tricuspid valve: septal, anterior, and posterior. It's very important for you to remember because when you're doing echo, you have to identify the right side of the heart from the left side of the heart. One way, or one of the best way to distinguish the right side of the heart from the left side of the heart, the tricuspid valve is usually located lower in the ventricle than the mitral valve. So the what we usually call the atrioventricular valve, which is lowermost, is usually the tricuspid valve. And I'll show you what we mean by that. But this statement is extremely important. Once you understand what the statement means, you need this statement for the rest of your echo life. Okay? Because it allows you to distinguish the left side of the heart from the right side of the heart. especially when you're doing ultrasound scan of someone with congenital heart disease. Remember, when the patient comes to the echo lab, the heart is not labeled for you, and things can be twisted and not in the right place. So you have to be able, you need to have some means of distinguishing which is which, so to speak. All right, the coronary sinus, that's a vein that empties blood into the right atrium. It runs in the groove between the left atrium and left ventricle and the posterior surface of the heart. And the right ventricle now, the right ventricle receives blood from the right atrium through the tricuspid valve. Blood is going to leave the right ventricle through the right ventricular outflow tract and in the pulmonary trunk to the pulmonary arteries. Okay? All right. So I mentioned a little bit about the pulmonary circuit. That is where the blood leaves the right ventricle. It passes the pulmonic valve and it enters the pulmonary trunk. And from the pulmonary trunk, it's going to go to the right pulmonary artery and the left pulmonary artery. Okay? So the deoxygenated blood that leaves the right ventricle through the pulmonary valves, there are three of them, to the pulmonary trunk. Then the pulmonary trunk branches into a right and a left pulmonary artery, which is going to take the blood to the lungs. It's going to deliver deoxygenated blood to the lungs, and because you're now breathing, you're going to add oxygen to the blood. So the blood is going to become oxygenated. So this is what it, again, deoxygenated blood we depict as sort of blue, suggesting that the oxygen is removed. So the veins from the lower extremity and the trunk, they're all going to drain into the inferior vena cava. From the head and neck, the veins going to drain into the superior vena cava. The superior vena cava and the inferior vena cava is going to drain blood into the right atrium. The blood is now going to move from the right atrium across the tricuspid valve into the right ventricle. This is deoxygenated blood. The deoxygenated blood is going to pass through the pulmonary valve into the pulmonary trunk. This is the pulmonary trunk. Then the pulmonary trunk going to divide into a right pulmonary artery and a left pulmonary artery going to the respective lungs. So it's gonna, the artery is gonna divide up into smaller blood vessels that penetrates the lungs. But when you breathe, you're gonna breathe in oxygen. So now this deoxygenated blood is gonna become oxygenated. That's why it looks bright red here. And then the oxygenated blood is gonna leave the lungs via pulmonary veins. So pulmonary veins are going to take the oxygenated blood from the lungs and they're going to drain into the left atrium. You have four pulmonary veins, two on the left side, two on the right side of the left atrium. Okay, you have an upper and a lower. Four pulmonary veins drain into the left atrium. So you see it's now bright red because it got oxygen from the lungs. So the oxygenated blood is going to travel, is going to move from the pulmonary veins into the left atrium. It's going to cross the mitral valve and enter the left ventricle. Okay? Then the oxygenated blood is going to leave the left ventricle through the aortic valve into the aorta. Okay? And then these branches going to give blood to the head and neck. The aorta is going to descend, giving blood to the trunk and the abdominal cavity and lower extremity. So this is basically how the heart works. Okay? Again, as mentioned before, the pulmonary veins carries oxygenated blood from the lungs to the left atrium. There are four pulmonary veins. Okay, these all four pulmonary veins drain into the left atrium. Two on the right side of the left atrium, two on the left side of the left atrium, and you have upper and lower. Okay, so again, this is your left atrium, this is your pulmonary veins. Okay, so this is where it opens, the pulmonary veins opens into the left atrium, and then two is on this side. You have upper and lower. Okay, and of course we went over the structures in the left ventricle. Okay, so if you cut the heart and you can see the structures, this is your papillary muscle right there. In the left ventricle, you have two papillary muscles, the coordinate tendonae, these cord-like structures, which, so these are coordinate tendonae. They attach to the undersurface of the valve. This is a mitral valve right there. This is your interventricular septum. This is the right ventricle. You have three papillary muscles in the right ventricle because this is your tricuspid valve. It has three leaflets. And you can see from the papillary muscles, you have these cord-like structures that comes off. Okay. Again, deoxygenated blood from the trunk and lower extremity enters the inferior vena cava. Oxygenated blood from the head and neck, superior vena cava, they both drains into the right atrium. Then from the right atrium, it crosses the tricuspid valve into the right ventricle. The deoxygenated blood is going to leave from the right ventricle through the pulmonic valve or pulmonary semilunar valve, pulmonic valve. This is the pulmonary trunk, right pulmonary artery, left pulmonary artery, going to go to the lungs. Then the blood is going to be oxygenated because of breathing. You're going to breathe in and out, so the blood is going to be oxygenated. So oxygenated blood is going to travel to these pulmonary veins into the left atrium. There are four pulmonary veins, two on the left side, two on the right side. Okay, the blood is now going to leave the left atrium across the mitral valve into the left ventricle. The blood is going to leave the left ventricle through the aortic valve is right here into the aorta, goes up. Okay, so that's the circulation in a nutshell. Again, just for depiction purpose, this is the left side of the heart, the right side of the heart. So your left atrium is right up here. You can see there are two pulmonary veins on the left, two pulmonary veins on the right. Okay, the pulmonary veins gonna drain into the left atrium. Rich oxygenated blood coming from the lungs. Okay, so um, so the left side of the heart, again, the left atrium receives oxygenated blood from the pulmonary veins. The mitral valve, which is located between the left atrium and left ventricle, the mitral valve have only two leaflets. It has an anterior and a posterior leaflet, just two. Again, the mitral valve tends to be higher in the ventricle than the tricuspid valve on the right side. Papillary muscles. These papillary muscles are located in the left ventricle and the right ventricle as well. There are two papillary muscles in the left ventricle. You have what we call the anterior lateral and the posterior medial. Uh, the papillary muscles attached to the papillary muscles, you have the coordinate tendonae, and these coordinate tendonae attached to the mitral valve. They prevent the mitral valve from prolapsing. Okay, so the left ventricle is going to receive oxygenated blood from the left atrium through the mitral valve, and blood is going to leave the left ventricle via the left ventricle flow tract into the aorta. So this is what I've been saying over and over, okay? I am going to stop right here, and then on Monday, so our next session is going to be on Monday, we will start from the aortic valve.